Hi guys. I hope you all had a good Easter break. I know you have a quiz on Monday, so I'm going to go over immunodeficiencies. Basically, her example is HIV. She said to our class there would be about 8 or 9 questions on the exam for this material, and I think it'll be on your quiz on Monday as well. So we'll start with cause of the virus. So your immune system is weakened. HIV is a parasite. So when you look at your cells, it's like a hiccup, like one thing went wrong. So now you have a parasite, which would be the HIV. Target is the CD4 and T cells. So those she'll ask you about those. They're really big. Those two cells are what are affected. Those are the target cells. So when you have an immune system deficiency, so you already have a weakened immune system, or HIV comes in, it makes your immune system weaker. So you're like, if someone dies from HIV, it's not only HIV that they would die from, it would be any complication that they get because of their weakened immune system. So that is usually what like the cause of death is like, oh, they had HIV. Well, they didn't really die from HIV, but their HIV made their immune system weaker, so they got a different infection, and that's what killed them. So takes over all the cells. So slowly it'll infect one, and then more and more and more cells will be infected. And then it's basically a worldwide epidemic. And it can also progress into AIDS. So HIV is like the beginning stages, and then AIDS is what happens like later after most of your immune system is gone. Pathology. So this is where she'll ask you about those CD4 and T cells. The HIV gets attached to them, and then that's how they get inside your body and then like rapidly spread to every other cell. It takes over the DNA. So once it gets into those cells, it goes into like the DNA and RNA and fixes them or changes them to be HIV, and then they just reproduce rapidly. It takes the T cells in the role of being the HIV factory, making 10 billion HIV cells a day. So once you have it, like there's no like getting rid of it because it makes so many cells a day. At first, the body will try and destroy these kind of cells because they know that they're wrong. But eventually, that there's so many HIV cells that because the CD4 and T cells got infected and then they multiplied rapidly, so then they can't kill your healthy cells, can't kill all the dirty cells or bad cells because there's too many. So at first, the body will destroy them, but within the HIV overwhelms the immune system. So a decrease in T cells, viral numbers, and viral load. She'll ask you about the viral stuff. She talks more about it later on. It just says T cells decrease, and then viral numbers, like the viral load, increases. So the number of healthy T cells decrease, and the number of the viral load increases. And then you have risk for bacterial, fungal, and viral infections because your immune system's down. So I wrote it over here. I don't know if you guys can see. I just wrote T cells decrease, which means immunity decreases. And then it takes over the healthy cells, makes HIV in the DNA. And then every day the viral load increases. So everyone who has AIDS has HIV. But not everyone who has HIV has AIDS. So if you have AIDS, it's like the more progressed stages, and it's because you had HIV. If you have HIV, it doesn't necessarily mean that it progressed to the AIDS part yet. So this is what makes the distinction. So the distinction, CD and T cells. Okay, so a healthy adult has 800 to 1,000 CD4 and T cells per cubic millimeter of blood. So remember that 800 to 1,000. She'll ask you that. HIV turns into AIDS because that number will decrease. So you'll have 800 to 1,000 in a normal, healthy body or person, and that will decrease, and that makes more opportunity for infection. But the 800 to 1,000, normal, healthy, 800 to 1,000, because that's what your immunity is. That's CD4 and T cells are your immunity. So you have a lot. And then once those decrease underneath that amount, HIV can turn into AIDS. So she gave you a list of like YouTube videos you can watch. We watched one about someone's story about HIV, and we just watched how like little videos of like this cell gets infected with this cell, and then all that. So they're good YouTube videos to watch. So the progression. So when you have HIV and it develops into AIDS, it can range from months to years. So just because you have HIV doesn't mean you automatically have AIDS. There are things you can do to slow the progression or stop it from getting to that far. Some people develop acute infection within the first 4 weeks of being infected. So some people can be infected fairly easily because your immune system's down. So of course, you're going to have some acute infections. Manifestations include fever, night sweats, chills, headaches, muscle aches. They're very similar to a viral infection. The signs and symptoms are, but it's not because you have a viral infection. Now it's because you have HIV. After a while, acute symptoms, they'll feel better again. So after like the 4 weeks hit and you have all those signs and symptoms I just said, it'll go away and the person will feel better and they won't think anything of it, because you would think like someone with HIV, like they just keep progressively getting worse. But at first, in the initial stages, after those 4 weeks, after you have that like symptoms, your body tries to fight it and then it gets better. And then slowly down the line, it'll get progressively worse. So they feel better. A war is going on between the HIV and the immune system. That's why you start feeling better, because your immune system after about 4 weeks is like, I'm better, I'm fine, it's going to be fine, we're going to get rid of this HIV. But then the HIV, since it multiplies so quickly, you won't get better. So diagnosis, she'll ask you questions about this. CD4 and T cell under 200. So we talked about a normal person has 800 to 1,000. The person with AIDS, not HIV, AIDS, has under 200. That's one of the criteria. And then, or it can be a presence of an opportunistic infection. So once you are diagnosed, once you're diagnosed with HIV, if treatment is successful, the AIDS diagnosis will not get that, like the things that will make it AIDS won't get that bad. Like you'll have T cells over 200 if treatment is successful. So pneumonia, yeast infections, oral thrush, and TB can all be like opportunistic infections. So if you have all of those or any of those with a decreased T cell and CD4 cell under 200, then you have AIDS. So you have HIV, you have more opportunity, and you probably have an opportunistic infection, and your T cells or CD4 cells are below 200. And then it says TB cannot produce antibodies. So the test, like even though you might test for TB, it might not come up as you have it because you don't show any antibodies, but you still have TB. So a lot of times when you come into the hospital with an opportunistic infection, you have under 200 CD4 or T cells. So you're in the criteria for AIDS. They put you on certain precautions because you can't test for TB because you don't have the antibodies to build up because your immune system is gone, if that makes sense. So just know the difference between HIV and AIDS. So HIV, you're usually about still healthy. You'll have a decreased amount of immunity. So it'll be like under that 1,000, but you won't be below 200 yet. And you don't have any opportunistic infections yet. Opportunistic infection, I think I've said it a lot, but just in case you don't know, it's caused by organisms that are a part of the body normally, but now since your immune system is weakened, it bounces on the opportunity to get you sick. So like a lot of us have certain like pneumonia cells, or we have like, just things that our body can usually fight off. Now it cannot fight it off. So it's an opportunistic infection because it is thriving on the fact that you don't have an immune system anymore. Things that make people susceptible to these, or like a weaker immune system, is also like cancer, chemo, things like that invade your healthy immune system as well. These classifications she won't ask you about. So I just have an X next to it. So she told my class she won't ask any questions about those. So incidence and prevalence, I don't think she had any questions about these, but there are 1.2 million cases in the US. She has like a death number, different people currently living with this. She didn't really ask any questions about this to us, but I think it was really interesting that 40 to 60 million are infected worldwide. So, we think it's never going to happen to us, but like the story that you watched for the YouTube video, the lady, she didn't think it was happening to her, and her ex never told her. I mean, it can happen to anybody, and it's just so scary that there's so many cases of it out there. Health promotion and maintenance. So there's no cure for AIDS. Focused prevention on getting HIV. So everyone is susceptible to it. Wear condoms. Ask your person, do they have any, STDs, whatever. Go get tested regularly. Even if you don't think there's a possibility, just go get tested. Is basically what the prevention is. Use condoms. Teach everyone about the transmission and the ways that it can you can be exposed to it. Stress HIV, not transmitted by, so if my partner has HIV and we live in the same house, I can't get it from them by being around them. So, and basically you have to have sex without a condom in order to get it. So just stress to people oh, I can't drink after them, or, oh, I can't, or, just be in the same house as them. Yes, you can. It's not transmitted at home, school, or workplace. But if you share household utensils, towels, and linen, it also can't be transmitted. So basically, sex without a condom is the only way you're going to get. HIV is not spread by insects. It's sad that she had to put that on there, but some people think it is. Transmission, so sexually transmitted. Highest risk for infection is a man to an unidentified woman or male. So some people don't show any signs and symptoms and they don't think they have it. And then they have sex with different people without a condom, and that's how it's transmitted the most. The goal is to decrease the risk for non-intact skin or mucous membranes. So if, that sounds really gross, but if, you have a cut on yourself and you get some liquid, if you know what I mean, it can be transmitted that way because it's an open kind of wound. But mucous membranes basically sex without condom. So potential transmission. So sharing needles, that's a good one because blood to blood. Blood or blood products. So the transmission rate is 25%. Transmission to healthcare workers is 25%. Not necessarily because we're going around having sex with our patients, but it's just it's higher for us because if we don't know they have it and they're not in certain precautions, standard precautions should get rid of all that. You wash hands in, put gloves on, do your thing, take your gloves off the correct way, wash your hands after. It should be fine. But we all know those people who don't, and you should, but some people don't. So people who really don't follow that, it's higher than 25% risk. But testing. So the goal is to diagnose HIV early, so that way you can treat it and you won't have any opportunist infections. A lot of times when you catch it early, you can also save part of your immune system because the treatment slows down the progression. If positive, goal is to prevent transmission to others. So all sexually active people should know if their partner has HIV, and if they do, how to prevent the spread of it. HIV and AIDS are progression. So with HIV, you should be monitored regularly every 2 to 6 months. They should be checking those cells. They should be checking how low those are. They should see if you have any opportunistic infections. Go through the history. So if you've been with people, you need to go tell them. A disease progression, so the longer duration is the greater severity. So the longer you wait to get checked, or the longer that it's been since you've last been checked, if you have it, the greater the severity of like what's actually going on. So nursing priorities, she just has C chart 19.3. Look at the chart. You know her. She always, if she has a chart, she usually pulls at least one question. Like it's a given question. You don't have to guess like what's going to be on the exam. You at least know she pulled something from that chart. So pathogen, opportunistic infection, we knew about this. A pathogen is caused by a virulent organism such as like tuberculosis. So it's mostly so when you have a decreased immune system and an infection that you normally could have fought off, like people get like TB testing. So like you should be able to fight it off if you do have it. But since you don't have the immune system to fight it, it won't show up in your lab reports that you have it, because you have to have a presence of an antibody for it in order to see if you have it. And that's the issue. Like when we all get those wheel tests, I'm actually allergic to the protein, so I have to go and get like chest x-rays. But when y'all get those little wheel things, it only like affects the wheel if you have antibodies for it. And that's how they know you have it. So it's caused by an organism that is normally present, but the immune system is able to fight it off. So account for many of the clinical manifestations of HIV. So when you have, I have a triple star, double star circled, it's bolded in the middle of this. So it usually is like whatever you have, the signs and symptoms is what HIV is, because you won't show a lot of those signs and symptoms if you have an immune system, because it'll fight it off. But when you don't have an immune system, your body just is at the mercy of whatever bacteria or injury or infection you have. So it can be like fungal, bacterial, viral. It can result in death if it's not treated quickly. That's what I was saying earlier about people who die of like the complications of HIV, like what infection they had, because HIV doesn't necessarily kill you, but it depletes your whole entire immune system, and that's the issue. Opportunistic infections, again, 19.3. Look at just what kind of viral, fungal, bacterial infections they can get. I have it starred, so you know she's going to ask a question. You know it. So just look at the chart. So other clinical manifestations, some people have like dementia, wasting syndrome, skin changes, kidney problems, just other manifestations that tell you like your immune system or something is wrong in your body. So psychosocial assessment, these people already think that they're like, they already don't believe in themselves. Like they already are like, I have HIV, it's horrible, I'm going to give it to everybody. They already have a decreased sense of worth. So don't make it worse. Don't act like, don't touch me. Don't like get away from me. Like these are people, they have feelings. They didn't sign up for this either. So it's good to have social support, confidentiality. If someone walks in the room, don't be talking about their HIV. Maybe this person don't know about their HIV. Look at their anxiety levels, their mood. So case interviews, assessments, activities, so they don't really have an energy level either. So just make sure that you're like, when you go in to get labs and assessment and daily weights, like just kind of cluster your care that way they can rest. They don't have an immune system. Imagine when you are sick and how tired you are. Like these people must be exhausted because they don't even have an immune system. So it's significant for others that so just legal representation is what she had like here. Significant other may not be a legal representation. HIPAA, I have written down HIPAA. Follow HIPAA at all times. So laboratory assessments, we talked about this. Lymphocytes can be under 3,500. Normal is 5,000 to 10,000. And then your TD and your T cells or CD4 cells, they're always under 200. Normal is 800 to 1,000. So look at those numbers. She'll ask you about those. So antibody tests measures the virus. I'll be ready in a minute. Oh, okay, thanks. Oh, we had snow? Okay. Anyway, So viral load measures the presence of HIV, so that increases. So over time, you're going to decrease all of your immunity. So your TD cells, why do I keep saying that? Your T cells or your CD4 cells are going to decrease. So with HIV, they'll just be less than 800, but with AIDS, it'll be under 200. So normal is 8,000 or 800 to 1,000. Under, if you have HIV, it's going to be under 800, and if you have AIDS, it's going to be under 200. Look at those viral load just always increases. When immunity decreases, the amount of viral load that you have will increase. Drug therapy, I have this all marked up. She's going to ask you questions. So stuff we already talked about. Try and get them on the therapy. So multiple drugs can be used together. The classification drugs, these are basically to prevent it from getting worse. So I have here minimum, why can't I read today? It's so small. Minimum inhibitory concentration. I don't know. I have it underlined. I don't even know if you can read it. So I have it underlined and starred. Know what that is. So certain levels in the body are, we talked about this. Decreased immune cells, increased viral load is what it normally is. So if certain levels in the body, if the medication is effective, what do you think you're going to see? You're going to see the opposite. So instead of an increase or a decreased immune system and an increased viral load, if it's working, it'll either like normal out or they'll even like flip backwards and you'll start to have an immunity and a decreased viral load. That's the goal of therapy always. So PEP and PrEP, she'll ask you about this. PrEP is pre-exposure. So you want to prevent, if your partner has it and you know it, you want to prevent that spread. So the partner of someone will take medications. It just decreases the risk of you getting it if you know you have it, and it prevents HIV from infecting that person once you're taking that pill. PEP is after. I had sex. I didn't know this guy had HIV. He told me he had HIV. I probably have HIV. PEP. So PrEP is like prep, before. PEP is like you did it and now you got to take some medicine because you probably have HIV too. So taking this will potentially stop the exposure. So in case you just found out you went to the doctor and they gave you this medication, it might stop the spread, which is great. But if you do have it, it'll just prevent it from getting worse right away. But it's used in emergent situations. Taking this after being potentially exposed can prevent you from becoming infected. Same. And then education pretty much is... Education is teaching your patient, do you have it? Okay, if you have it, how are you going to stop the spread? And if you stop the spread, great. But if you don't, you need to tell everyone you do have, educate the family to be supportive. The outcome or the goal is to maintain the highest level of function as possible. These people have HIV. They're going to get infections. They have to take care of themselves. Right now in this whole COVID crisis, I bet they're terrified. You see everyone wearing masks and gloves anyway, but these people are really scared because they, my body, I'm a healthy 20-year-old. I'm sniffling because I have allergies, but I'm a healthy 22-year-old. So I will probably be able to fight off this COVID infection if I get it. But people with AIDS will not. They will most likely die because this infection will kill you. So making their quality of life the best that you can, reduce infections, and maintain quality of life. So if you have any questions, I know I kind of went over it a little quick, but it wasn't a big PowerPoint either. You guys will do great on your quiz. I'll do another, I think I do hepatitis and something else next week for your exam. But you guys will be good. If you have any questions, Robin, myself, just keep looking over your PowerPoints. I hope you're all staying safe and healthy. I miss you. All right. Have a good day. Bye.